Okay. Okay, so hello to everybody again. My name is Shira. I'm the cord blood bank nurse in Sheba Hospital here in Israel. And together with my husband, Chagai, we are assisting families to receive information about clinics abroad so they may be able to approach these clinics and receive treatment. We have patients from all walks of life, but especially children with autism. We have some adults in our group, and we are hosting you today, Doctor. So if you
Hi.
can present yourself.
Yeah, hi, I'm Dr. Travis Whitney. I'm the founder at Innate Healthcare Institute. We're a clinic in Phoenix, Arizona that specializes in umbilical cord mesenchymal stem cell treatments and functional medicine as well. We do some integrative medicine, almost always that's included with our stem cell treatments.
Okay. So if you can explain to our patients, what will be a protocol? What would it look like? What would it entail for a child, let's say with autism?
Okay. So for a child with autism, what we tend to do is a dosage of starting out at 300 million stem cells. So that's how we dose the cells, is in the millions, typically in the millions. I see some studies where they in the hundreds of thousands, but typically they're dosed in the millions. So through some clinical type research, basically trial and error, the lower doses, we didn't seem to be getting as good of a response, somewhere like in the 100 million or less range. But we were noticing these kids that we were doing with 300 million were responding a lot more significantly and a lot more faster. So that's on average a dose that we tend to do. And what we do is we take those 300 million cells and we'll break them up into, depending on the weight and age of the child, 3 treatments of 100 million. So let's say you come in on a Monday, we'll do a treatment on a Monday, Tuesday, and a Wednesday, every day like that. We'll administer the cells intranasally, which involves spraying them back into the back of the sinus cavity here, where there's a collection of nerves and blood vessels that goes up into the brain. We do that with anything neurological. We do that in dementia, Parkinson's, Alzheimer's, any kind of neurological treatment where we really want to focus on the brain. We'll just vary what catheter we use. So in kids, what we'll use is this, what's called a mucosal atomization device. So this little part gets attached to the syringe, and this little soft, squishy wedge part is what it gets up into going in their nose. And then this just basically turns this collection of stem cells, which is in saline, into like a spray. And it sprays it in the back of their sinus cavity. We'll do an intramuscular at least twice. So that's just a shot in the arm. The stem cells get mixed up, broken down into saline, and they get injected into the arm. And then at least one of the treatments, if we can, we'll do an intravenous, which is, just in the arm.
Okay.
And so that's a typical course of autism. And then we incorporate the integrative part, depending on what's going on in that child, like maybe some sort of toxins, where we'll run like a urine sample to look for any kind of like mold or yeast or environmental toxins, or running a stool sample where we'll look for like dysbiosis in the gut. Maybe there's like a parasite infection, a bacteria infection. So there's a lot of stuff that we can glean from those results too. So we'll incorporate that in with the stem cell treatments.
Okay, so all in all, you give 3 million cells per kilo,
No.
or is it 3 million cells per treatment?
We actually dose more like 5 to 6 million cells per kilo.
Per kilo
I go
for
a little
the entire
higher
treatment, though.
Right.
So if you divide it into 3 categories, you would still eventually together will have 6 million cells per kilo.
Each day that we're doing a treatment, somewhere around there. So typically we're doing about 100 to 150 million cells each day on a child.
Per day. Okay,
Yeah, per day.
So depending on the child's weight.
Correct.
Okay. So on the same day, the same child will receive a IM, an intramuscular, nasal spray, and an IV treatment on the same day?
No, they're usually, so on a same day, it'll be intranasal and intramuscular, or intranasal and IV.
Okay. And on your program, children get 2 rotations of treatment?
It depends on how many cells we end up using total. So if it's 300 million, we'll use those 3 days in a row. And then typically families will wait about 3 to 6 months, see if there's any progress. And if there is enough for them to want to come back for more, then they'll come back for more treatments.
Which is what we know from other clinics. We wait 3 to 6 months. And then if there's any influence, you come for a second treatment. We did hear from some of the clinics that it's recommended to do the treatment at least twice before you determine that there's no effect. So you think the same?
Yes, I wholeheartedly can agree to that. It's your child, like it's their child. It's them as a family. So I've never rejected somebody that didn't say like, well, we're gonna come back for 2 for sure. If you just want to try one and see how it goes, that's up to you. But if you go to our YouTube and you're reading our success stories, a lot of those children have had 2, 3, 4 different treatments. And a lot of our families just go ahead and sign up. Like we have a plan of 1.2 billion cells. So we'll use 1.2 billion cells total, but we'll divide those into like 4 treatments of 300 million. So they'll come in, we'll do that 300 million over 3 days. Usually they'll come back in like 3 months, depending on, where they live or what they've got going on. And then we'll do that again. And then we'll wait 3 months and we'll do that again. So that one's really popular. And that one, we pretty much always see good results, at least, especially by the second and third.
Because what it means is that you promise that this child will get consistent care. So you will receive stem cells over and over and over again. And that's why we see an improvement, which I can honestly say that I've seen the same with my patients. So when I send patients abroad or where we treat them here, then this is what I see. There's a question from the crowd. If you can give an example for a ASD child that weighs 30 kilo, what would the program look for this child? And on what day? So the mother wants to know, the parents wants to know from the day of arrival, step by step, what will happen to this child.
Gotta do my math. So 30 kilos, that falls right into easily doing like 150 million cells a day. I'm not worried about overdosing. They've done some research. My stem cell biologist was actually we were just talking about this not too long ago, where now they're doing stuff like 10 million cells per kilo, and like you don't see any side effects really or anything bad happening. So we're really not worried about administering too many at once. It's always the safety of the child first. For here in Phoenix,
what parents need to know is what happens from the moment they step foot in your clinic until the moment they go home.
Okay. So, you come in, you sign the consent forms. We'll move you from the waiting room into, I'm trying to think of like how specific should I get. We'll go from the waiting room. We kind of have a dedicated autism room where there's big lounges. I guess I can take the camera in there and show them if they want. But there's big, like kind of reclining chairs and a TV. So we try to have like the kids' favorite TV show or something on. That way they're kind of calm, they're settled. We don't want it to be a traumatic experience for them. So usually they hang out, chill, watch TV. We have toys in there that they can play with. We'll come in, one of the doctors will come in, talk to them, see if they have any questions about the procedure. We'll go over the procedure with them. We'll go over, a little bit more history, of course. And then usually during that time, or maybe just after that, someone else like Angela or somebody, our medical assistant or somebody, is preparing the cells for however we're going to deliver them. We always like to show the parents the collection of the cells, because once you get that many cells in what's called a falcon tube, in a little the tube we centrifuge it in, it's very visible. It'll be like a little blob of cells about that big. So parents and stuff, they like to see that stuff. And so we'll go in there, we'll show them the cells, and then we'll prepare them for administration, and then we'll do the treatment. And then, you're free to do whatever they want. There's no downtime. It's an outpatient procedure. You don't have to stay overnight at the clinic or anything like that.
Do you need to do a blood test?
No, you don't. We don't. There's no required blood test. If we are doing any labs that day, we'll do them, or we'll go over the family how to do them. If it's a stool sample or a urine sample, or if we are drawing blood.
So you don't draw blood at all? You don't want to see a CBC or a KIM or any clotting factors, blood type?
Yeah, no, we've never had a need to do that.
Okay, so how would you know that this is not, God forbid, a child with leukemia, for example?
How would we know if a child had leukemia?
No, how do you know that this child is not ill? He doesn't have some blood disorder?
We don't. Unless that's something that, leukemia, the kids with leukemia are typically very sick. So that's something that will get identified before they come to our clinic. We are, when we treat autism, we're treating, we're treating ASD, maybe ASD and cerebral palsy, or like other concomitant conditions, and we would have to run a cancer panel on every kid, but usually we're not really ever too worried about that.
Okay. Are you concerned about children with anemia? These are stuff that can happen with autistic kids. You don't always know if they're anemic. You don't always know what their, coagulation is like, because we don't often test these children. It's very difficult to take blood tests. And so this is a question we ask all of the clinics, what kind of blood panel they run. We were told by other clinics that they do check for HIV, hepatitis as a legal procedure. So they make sure that, that they know that the child doesn't have it. And if in the future he will develop it, they can tell, listen, we got tested, he had it before, etc. So we had different answers on this question. So I thought it was fitting to ask you as well. Okay,
yeah,
so
no, mostly they have their pediatrician, they have their specialist. We do a little bit of testing, but we're very treatment focused. People are coming here for the stem cell treatment and the other integrative treatments we do. They get all the other labs and testing done usually back home with their primary care or their pediatrician.
For these tests, do you ask for blood work?
Yeah, so if a parent is going, typically in the States, they'll be going to what we call a functional medicine doctor. So typically go to them. Otherwise, your average pediatrician or primary care doctor in the States, they probably won't run a lot of those labs unless they feel there's a strong need to.
Wow. No, it's very different than what we have here in Israel. Blood tests in Israel are free.
Oh, yeah.
For all.
Yeah. Well, the best they could hope for is that it's covered by their insurance, but the insurance will dictate to the doctor if those labs will be covered or not.
Wow. No, we don't have that problem. You can ask
Yeah,
from the Israeli group whatever blood test you want.
cool.
We have it all. We have it for
That's
free, as much
great.
as you want, no problem.
That's great.
Um, yeah. Anyways, so the child will arrive, you will see the child, see that everything is fine, and then what will happen?
Yeah, after we do the treatments,
What will be the treatment on the first day?
so depending, we have a pediatric autism specialist that does the IVs. So she mostly does all the IVs. So if we have her scheduled, we'll do an IV that day and we'll do an intranasal. Sometimes I have to do the IVs. So we'll either do one of the IM or the IV on the first day. Of course, if we do the IV and the intranasal on the first day, then the second and third day, or just the second day, we'll do the intramuscular and the intranasal.
Okay. And then the child comes in, it's an out-care procedure. How long does he have to stay in the clinic to be supervised?
Parents, families usually leave within 5 minutes.
So 5 minutes after IV stem cells, they can leave the clinic?
Yeah.
Okay. Because usually here in Israel, we keep them for 2 hours observation.
What for what?
We monitor for any allergenic reactions and see that the child is eating, drinking, seems to be okay.
Have you ever had anything bad happen?
Yep. We had allergic reactions.
To umbilical cord stem cells?
To cord blood.
Cord blood, yeah. Yeah, so with cord blood, right? It's it.
Yeah,
We're
you
talking
have the
about
SMO.
no,
Yeah, there was
yeah, we're it's apples and oranges here. Cord blood, you need to do your HLA matching. You do need to make sure if there's going to be any kind of reaction. With umbilical cord tissue, like we're using, we don't have that. We don't have that concern.
we did have one child that came with us to a treatment and he was vomiting for like 24 hours after the treatment. He had like some kind of metabolic issue, I guess, which the parents didn't know about. But
okay,
that's a concern. If nausea, fever spike.
Yeah, but I would say it's like less than 10%. Most time what we see is, and I guess there's really no need for us to keep them there, but sometimes they get a little more hyper and sometimes they get like a lot calmer. Like they'll say, oh, we went home and they fell asleep in the car and like they slept for like 3 or 4 hours. And we've had we had one little girl, probably like within a month ago, she threw up like the next day or so, but we think it was more because she was so worked up. She was crying so hard, like the whole time she was here. And I just think, she just kind of worked herself up too much and got a little sick and threw up. And then, we told the mom, watch her, make sure she doesn't, she has electrolytes and fluids and make sure she doesn't keep vomiting and let us know. But then she said nothing ever happened again.
Okay.
So we do get little instances like that, but it's like every 1 out of 20 or so will have like some little small incident like that will happen.
Okay. Do you provide any kind of anesthesia or any kind of some people use dormicum or stuff like that to help children who cannot handle the procedure?
Yeah. So we have some natural kind of like, I hate to even call them sedatives, but we have some natural calming herbal like kind of medicine. So we'll try to start with that. Sometimes that works like good enough. If not, we have some of the bigger kids we've treated. We've used medications like Xanax. Just use like a small dose of Xanax to help them calm them down enough to go through the treatment. We're getting a system called Pronox, which is about a 50-50 mix of nitrous oxide and oxygen. And so it's not like a sedation. It's not fully under. You're just kind of how it's described is you're almost kind of like drunk.
Oh, we
Like
know we use nitrous in Israel. Here we
nitrous
use it
oxide.
in a dentist office on a routine basis.
Yeah, just like in a dentist, like
Yeah.
that.
No, we are very familiar with nitrous here in Israel.
Yeah.
The parent who asked about the 30-kilo child wants to ask more specifically, how many cells will you give intranasally and how many would you give intramuscular or an IV per day?
So it breaks down, the majority of them go intramuscular or IV, so 75 million to 25 million. Or if we're doing like 150 million cells for that treatment, it'll be 100 million to 50 million.
So 100 million will go
the smaller
either
dose is
IV or
intranasal because
intramuscular.
we use a smaller amount.
Okay. Questions forgot. Sorry, I have a blackout. It's been a very long day for me. Okay, how many days treatment altogether?
Typically 2 or 3 days, depending on the size of the child and how many cells we're using.
Okay, and what age groups do you receive to your clinic for ASD?
We mostly see about, I would say, from 3 to like 6 or 7 years old. And then we have, we have a few, just like, like that bell curve where you have outliers on each end. We have older kids. We have 11, 12, 13-year-olds. We have teens. We have some small ones we've done 2 to 3 years old. But mostly we're looking at about like 3 to 7.
So do you see teenagers?
Yeah.
Yeah.
Yep.
There is a question here. Where do you receive the cells from?
So we receive the cells from cord banks, and sometimes the hospitals store them here in the States.
Okay,
so
it's not
that typical
one
process is a mom will be asked if she wants to donate her cord or she wants to keep it and bank it. If she doesn't, then it'll go donated, and then they'll start testing her with both questionnaire screenings and blood tests to make sure there's no like communicable diseases, and then once it's donated, I'm pretty sure like the donation centers, they test them again, but I know we test them like either a second or third time to use. And if we're going to use them, so we test for safety, but then we also test for efficacy, like how well the cells are dividing, their morphology, like the shape, if they're secreting enough proteins. And so if they pass all that, typically about 1 in every 20 cords will get used to go on and extract the stem cells from them and then grow those stem cells out.
So in the States, are you allowed to manufacture stem cells?
No, you can't manufacture them. So the FDA, right, are what's called our Food and Drug Administration. Their stance is that if you start manufacturing their stem cells and distributing them for a therapeutic purpose, well, now that kind of makes them a drug. So that falls under their jurisdiction. So in the States, there's commercial labs that sell, they can't call them stem cells anymore because they don't have stem cells in them. So they call them biologics, or maybe even regenerative products, but they mostly refer to them as biologics now. So those fall under FDA regulations. Well, we have our Constitution, right? Our Constitution of the United States. And in that Constitution, it says that medical decisions between a doctor and a patient is made at the state level. So each one of our states has a state medical board, and that state medical board will tell a doctor what he or she can't do. The state medical board in Arizona and a few other states is very proactive. It's very pro-patient. So there's a lot of things we can do here in this state of Arizona that can't be done in other states throughout the United States.
So in Arizona, are you allowed to harvest and manufacture stem cells for medical purposes?
Yeah, so what happens with that is once, like, you as a patient, let's say you're a patient and you're coming to me and you're saying, hey, my kid has autism, or I have back pain, or whatever condition. Is there anything you think that you could do for it? Or would you recommend stem cells? So now me and you have a doctor-patient relationship. So it's really nobody else's business about what goes on between the doctor and that patient, right? So if I want to say to you, you know what, I've seen a lot of success with autism, or I've seen a lot of success with degenerative conditions using this source of stem cells from an umbilical cord. Do you, it's experimental. Do you want to try it? And if you're like, yes, I want to try it. Well, now that relationship is between me and you. And so now I can do whatever I want with those cells, essentially.
Okay, that doesn't answer my question. Are you allowed to make those cells?
You're allowed to derive cells from umbilical cords in the lab.
Yeah, so that process I just explained is why I can do that. But I cannot sell them. If you open a clinic in New Mexico or Florida and you said, well, hey, I want to buy these stem cells from you and I want to use my patients, I'd say I can't help you, sorry.
So you can make the cells locally?
Right, as long as I'm using them on my patients, I can.
Okay, I get it. Okay, so I'll explain it in Hebrew. I'll explain it to you. If it's correct, I'll explain it again in Hebrew because it's a little complicated. What I understood from you is that if you receive donated cords from a donation center and you make them for your patients locally, you are allowed to give them to your patients only.
Correct. These are only used for our patients.
Okay, I'm going to say it again in Hebrew. אם הוא מקבל חבלי טבור ממרכז ההשתלות אליו למרפאה או למעבדה, הוא יכול לייצר אותם אך ורק עבור החולים שלו, הוא לא יכול למכור אותם. זה מה שהוא אמר. אני עכשיו פותחת, עכשיו אני אפתח את הבמה אליכם לשאלות, ואתם תוכלו לשאול מה שתרצו. I am now done with my personal questions. I'm opening the floor to any patient who would like to ask. If they have a problem to ask, I will translate. Okay?
Okay.
יאללה, חברים, תשאלו מה שבא לכם. תשאלו, פשוט תשאל. אל תכתוב בצ'אט, תשאל.
מיכל שואלת.
מיכל, תשאלי.
They're asking what passage do you use?
Typically no more than one.
Okay.
So
the same person is asking because she's putting her child to sleep, so she's not able to physically ask. What if you have the permit to make them? Does your lab have the permit to make them?
We don't need permits because we're not under the FDA regulations. So we don't need a permit or a license because we're not distributing them. If I was trying to sell them to other places, I would need a license.
Okay, I understand. Questions, anyone? מיכל, עוד שאלות? תכתבי, אני אשאל. מישהו רוצה לשאול עוד משהו? הנה. רגע, אני לא מצליחה... אוקיי. מה כתב פה?
I don't know, it's not in... Are the cells produced in something environment?
Oh, I know. Can you tell us what about your lab? About the
I want to say it's an ISO 4.
It's a lab standard.
Yeah, it's still GCMP certified lab. but I see the question from Rachel. It's produced in an ISO 5 environment. I want to say, I believe, Rachel, it's an ISO 4. I'd have to ask the stem cell biologist that one.
Okay. And he said he uses one passage, Chavachat.
Yeah, either P0 is the P stands for the passage, of course. So P0 or P1.
Okay, so that's either the original cells or the first
Lineage.
generation.
Yeah, we don't.
Cells.
Yeah, we don't stretch it. We don't stress them any more than those first few passages because they don't work as good. And again, I'm not the stem cell biologist. This is my understanding. I'm the clinician. This is from my understanding of you know the years of working with the stem cell biologists. But yeah, once you start growing them more than 1 to 2 passages, they start losing a lot of their potency to repair, to regenerate, to send out those cytokines they make and secrete those paracrine factors.
Okay. Can you send us the license for the clinic? Because we do attach it to each video. Is it possible to receive like legal paperwork about the clinic?
Mm-hmm.
Okay.
What so like the clinic itself doesn't have a license. I have a medical license. Is that what you mean?
That too, I guess.
Yes, definitely your medical license. So how are you able to provide medical care if you don't have a license?
So the doctors have their own licenses, but when you said, can you send the license for the clinic doesn't have a license.
Okay,
The clinic
does your
would not
lab have a license?
Sorry?
Does your lab have a license to you know, to make like, is it recognized by the Ministry of Health? We're not clear on how clinics like yours can exist in the States, because we know that there's a legal problem with clinics to exist in the States on that format, on stem cell format. And I think this is one of the reasons people are like worried. How does it work? Is it legal, etc.?
Right. So that's kind of what I was answering when we were talking about our Constitution and things being dictated at the state medical board.
Okay. And you make the cells in a lab that's affiliated with you.
Yep.
And this lab.
So it's a non-commercial entity. Like, so we're not making them for like commercial manufactured products to sell to hospitals or clinics or stuff like that.
I'll tell you what the issue is, because here in Israel, let's say I want to make stem cells in my hospital and I use them for my patients. I don't sell them or anything like that. Somebody from the government would come and see that my lab is clean, that my personnel are equipped to do this, that my facilities are up to code, that I'm not working basically on my kitchen table. To say it in plain words. What is the equivalent in your clinic to this kind of supervision?
I'm sure some of that is FDA for sure. I don't know. That's a good stem cell biologist. He'd probably know more of those questions.
Okay, is it possible to speak to that person and have him answer this very complicated question? Because for us, listen, here's the thing. In our group, we see anything you can imagine. We see clinics in third world countries that are definitely not standing in any good health criteria. We see very high-end clinics. And we ask them all to say, who is the man in charge? Who is the person making sure that nobody dies in the process, basically? That the cells are healthy cells. That we are not shooting up people with saline and promising them, you know, big promises. So we ask this question, and honestly, we receive all sorts of answers. Some of them say nobody. So they say, listen, this is a government supervised entity. You have to have a license. You have to have, you know, the Ministry of Health coming in for supervision, etc. So we're asking you.
Yeah. So like I see things like, and some of them I don't know if it translated as well. Like Rachel's, can we see the environmental monitoring results for the lab? Like, I don't know what those are. I don't even know if we have to have those. If there's a difference between making, like, having those things for an in-house kind of lab versus having those for a lab that's producing commercial products, you know? So send me, all these questions that we're not, like, I'm not answering 100% that you like. We can send them to the stem cell biologist and we can send them back to you, and that way everybody can try to get as best of an answer as they can.
There are some questions that are written in English in the chat.
Read the last one.
If you can speak a little bit about that subject. You don't use any DMSO in the process?
No, now that one I do know. We don't use any, we don't cryopreserve in DMSO. We cryopreserve in trehalose, TREHALOSE. There's that, there's a pH buffer, there's sucrose. There's only a few things in there to help keep those cells alive when they're being thawed or when they're being frozen, and when we're thawing them.
Okay, so
because they need food, right? They need food to survive. They need oxygen. So there's even an amount where if a cryo vial is this big, like we don't fill it up all the way to the top, because if you did, they would starve of oxygen. Yeah. So there's little things like that needs to be.
But these are frozen cells, so you make them for in-house patients and you freeze them. Yep. Okay. I don't have any more questions. Do you?
If somebody's coming from abroad, let's talk medical tourism. If somebody's coming from Israel to your clinic, where are they going to stay? Who's feeding them? This is not something that's included in the service.
No, we're a lot more, it seems like medically based. I don't know, like I know there's places in Mexico where you pay, it seems like a good amount, and part of that is them picking you up from the airport and them providing you the room. What we're charging is going towards the medicine. We don't upcharge, or we don't add in their fees for where you stay. If you want to stay in, like, if you want to rent a small little Airbnb or stay in a little hotel, it's up to you. If you want to go stay in a 5-star resort, that's up to you.
How much do you ask for?
How much do we charge?
Yes. Yeah.
So it could be anywhere from $5,000 to what we have plans for, like $59,000. So like 300 million cells is 11,500. 1.2 billion cells is 26,000. So it really depends on the amount of cells that we're using. Let's say for the one treatment
for this 30-kilo child, 3-day program, so 2 IMs, 1 IV, and 3 nasal treatments. How much will one round of this kind of procedure for the basic, 30-kilo child? How much would that cost?
If the family just wanted to start with one series of treatments, 3 treatments, and we're using 300 million cells, then it would cost 11,500.
11,500.
Yes.
Okay. I'm just writing it down. I'm sorry.
If they wanted to stay here longer, or if they plan for more trips, we do 1.2 billion cells, which is 26,000.
26.
26.
Okay. Shelot, חבר'ה.
I have a question. You said that the treatment that the kids get is as an outpatient, you don't keep them in. But then again, it's a 3-day treatment. And you said you release them home or wherever straight after they get their treatment. So who takes care of them? Who is in charge in case something does happen, in case the child doesn't feel well? Who monitors them? Because honestly, it sounds way different than what we know here in Israel. We stay at the clinic for a good half hour after a flu shot to make sure
Wow.
that nothing happens. So
Yeah.
it really sounds weird to me that you send people right out of the clinic right after they get their treatment.
I mean, unless somebody presents to me like really good evidence to keep them here, we've never had any major side effects. The ones I told you happen less than 10%, and they're very minor, you know, like maybe the kid gets a little hyper, maybe they seem a little fluish, but that rarely ever happens. So the parents look after them. If there's any complications, they call us immediately. If not, like, let's say something were to happen at 11 o'clock at night, at midnight or something, there's urgent care and ER departments here that you would go to. We've just never had, I mean, we've been doing this for years and we've never had anything remotely bad like that happen. There's not a strong urge for us to.
How long is your clinic open? How many years are you open?
We started doing stem cell medicine full time in 2018.
Okay. I think it looks weird to us because the medicine in Israel and Europe is so different than the medicine in the States. In Europe and in Israel, it's very similar. You have HMOs that functions differently because
Okay.
both in Israel and in Europe, the government pays for these facilities some of the payment, and we pay some of the payment. And you have a set of things you deserve to get, which most of your medical care falls under these criteria for free or nearly free. You still have to buy your antibiotics and such, but most of it is subsidized. And honestly, I know that we Israelis like to complain a lot about our medical system, but it's actually pretty good. We get most of the basic care for next to free or nearly free. Let's say hospital stay won't cost you a dime.
Wow.
You can admit yourself to the hospital any given time for any given reason and pay zero. Really zero.
Wow.
As you know, as long as it's not like a boob job, basically. So the healthcare system in the States is wildly different.
Yeah. So that's
and I don't think the people here understand what you're talking about. To stay in the clinic will cost you money. To hold your baby after you've had a baby in the States would cost you money.
Yeah.
We don't understand this at all.
Yeah. So a lot of people they'll pay money to come to clinics like mine because they can't get the care in the hospitals and other places like that. It's not for a lack of caring that we don't keep the kids there longer. If you want to stay, I mean, well, most of the time we have treatments like back to back to back. And we are building a new clinic.
Lounge.
Yeah, if they wanted to stay here, I would never tell a parent, well, no, you have to leave. There's really genuinely no strong reason for us to like monitor the kid. I that's just a testament as to like how safe these treatments are.
I think it has to do with cultural and standard of care that's different from one state to another. We have been in treatment in Serbia that does a treatment fairly similar to what you are doing. And we were asked to stay for 2 hours for supervision. Again, they also said, listen, we nearly ever have a problem, but just in case you have to stay. And so we did. Same in Israel, you have to stay for cord blood, you have to stay at least 2 hours within the clinic. Here in Israel, it's being done in a governmental funded hospital. So, it doesn't cost you anything to do self-donated cord blood here.
Yeah, so cord blood, I can understand that a little more. But what I hope people that are listening are understanding is that we don't use cord blood. We use cord tissue, which has an immensely higher track record for being safe, for not having any rejection.
Okay, well, I mean, I understand what you're saying. It's culturally, medical culture here is very different.
Yeah.
And so for most of us, it sounds a little strange. I mean, 10% for us here in Israel is not acceptable for complications. Like for us, like a vomiting child, even though it can be, from nerves, it can be from whatever, for us, it would be a reason to keep them in, basically. Anybody else wants to ask something else? מישהו רוצה לשאול עוד שאלות?
Okay.
Okay.
Any other questions about other stuff
just a
besides
second.
autism?
כן,
אני רוצה.
לכי על זה. את צריכה שאני אתרגם אותך?
מעניין אותי אם טיפלו בשבץ במבוגרים.
This lady wants to know if you ever treated stroke in adults.
Yes. We do a combination of IV and intranasal procedures. So actually, I brought one of those as well. So this is a specialized catheter. The syringe goes back here, and this gets threaded through the nose to a special part, a collection of nerves and blood vessels back here in the sinus cavity. And so we administer the cells that way. And actually, yeah, we just did a follow-up with one of our stroke patients. She's doing really well, not forgetting as much, not stuttering. She's talking a lot more smoothly. So she looks like she's recovering really well. People don't seek out stem cells for post-stroke a lot. It's not something we see super common, but we've definitely treated it and we've seen improvements for sure.
ותסמונת שיאן syndrome.
Yeah, I have quite a few patients in the last year with Sheehan syndrome. So a stroke of the hypophysis gland postpartum.
Okay.
Have you ever seen a patient with that syndrome?
No. Not that I can remember. Yeah, that's a very specific area of damage. But again, I would, you got to look at the risk to reward benefit. When I talk to patients with conditions like that, like what other options are there, out there? I would still recommend a lot, multiple days of intranasal deliveries so we can target the brain as much as possible. And IVs seem to help a lot as well. When we're focusing on neurological treatments, what we do is we do an IV of mannitol before we do the IV stem cells, which helps thin the blood-brain barrier. And we also use some other nutrients like magnesium sulfate and arginine. We use those to help open up the blood vessels in the lungs. That way the cells don't get entrapped in the lungs a lot.
These are medicine we know here in Israel. I treated personally with mannitol for stroke patients here in Israel when I was working on that part of health.
In the hospital, yeah.
Yeah.
So we use those.
And we do treat these kind of patients with these kind of drugs. Just before we leave, a quick word maybe about other kind of conditions you treat, maybe with adults.
Alzheimer's, Parkinson's.
Diabetes.
Yep. We have type 1, type 2, diabetes, dementia, Alzheimer's, Parkinson's, a lot of orthopedic. So just about any kind of pain in a joint you can think of, back, knee, shoulder, neck, hips, ankles, we've done or do. Autoimmune conditions. I don't know if those are really big. over there, but they're really a little too big here.
Yeah, we're Jewish. We do autoimmune disease.
Okay. So we see a lot, with a lot of different autoimmune conditions.
We have a lot of Hashimoto.
Okay.
Do you treat Hashimoto?
GI complications. So either like Crohn's disease or autoimmune conditions, or just unexplained conditions of the GI system. What we do is what's called an intraperitoneal administration. So we go about a hand's width beside the belly button. We have an ultrasound machine, and we administer the cells or biologics, exosomes, if we're using them, just on the top layer of where the intestines are. And these get
okay,
picked
I
up
know how you do it. Yeah, we do perineum dialysis in Israel. It's basically the same, same way of delivery. Okay. מישהו רוצה עוד משהו לשאול לפני שאנחנו נפרדים?
I did want to know about Alzheimer's and Parkinson's. What kind of results do you see after administration?
So usually it's a report from the patient and one from the family members, right? So usually the family members will say things like, oh, their personality is returning, their memory is returning, they're not asking the same questions over and over again. We can just kind of tell there's like this different life in their eyes. We can just tell there's something that are clicking a little more versus before. Musculoskeletal, like coordination, will start to improve. Usually that's something like the patient will tell you. Anxiety is really common in those two conditions, and we'll see those improve and get better. Patients will just kind of start feeling like a little more confident, and they'll say things like, I feel more like myself.
Okay, that's awesome.
Wonderful.
Yeah. And then you have things like objective tests, like memory exams and stuff like that, which we administer to, like little cognitive assessments.
Okay. עוד משהו, חבר'ה?
Okay. I think we're all out of questions. I don't see anybody in the crowd typing anything. So thank you very much for your time.
Yeah, thank you.
In the future, if we will organize a convention from our hospital, will you be willing to join and give a lecture?
Sure. Yeah, if it's, as long as it's helping people, I'm open for it.
Okay, wonderful. Thank you very much for your time. And we will see you all on the next lecture.
Okay, thank you.
Bye.
Bye.
Thank you.